the website up. Okay. So if you don't know me, my name is Adriana Alejandre. I am a licensed marriage and family therapist in the state of California, and I'm the founder of Latinx Therapy, which is a national directory and a bilingual podcast. We have episodes in English and in Spanish about mental health myths, taboos, and we demystify some of these commonly in our comunidad. So with that, I also want to add that I have a group practice in California. There's about, I think, 5 Latina therapists at my practice right now. It's called EMDR and Trauma Therapy Center, and we are virtual and in Burbank. So I stay very busy. On top of this, I also have a foundation, a nonprofit called Alejandre Foundation, where we allocate $100 per session for 8 sessions for the Latinx community. So we pay for those sessions. And I think our application is going to open up in January. So, all right, let's go ahead and get started. With any of these topics that I'm going to talk about, it is going to be a brief overview. So there may be some details that I am missing. And I am so sorry, I could not figure out the comment situation. So I won't be able to, I don't think you could submit comments live, but after this is posted, I will go ahead and open it so you can leave your comments afterwards. Okay, so from here, when you go to latinxtherapy.com or terapiaparalatinos.com, you will go ahead and go to find a therapist. Here we have the option now that you have to select if you want someone in person or online. For this example, let's say we want someone online and you need the age of the client. Let's say you are a caregiver, a parent, a tia, cousin. Let's say you're looking for someone that specializes in adolescents, ages 14 to 19. I would recommend for toddlers or children for that to be more so in person. And I did not select the state, so you have to select the state here as well. So let's go down to Florida. Okay, so there are 23 results here, and you can see a little bit more detail. So here you'll see if they speak Spanish, what other languages they speak. If they do not speak Spanish, then it would say English only, okay? And so if you see therapists that show outside of Florida here, like let's say New York, this therapist most likely is dually licensed. They're based out of New York and they have a license to practice virtually in Florida. Okay, but let's go with Andrea Vargas here. Let's say that one says child and adolescent counseling. You read their profile. Everything looks good. They specialize in what you're looking for in regards for this teen. You see this, all looks good. You send them an inquiry here. So you submit your name, your email, your message, you read this, and then you press send. So typically it does take therapists a couple days to respond. So just when you go into the search, go in knowing that it will take a few days, and they'll let you know their process. In their profiles, you have phone numbers. Some of them will not for safety reasons. And so you can go ahead and email them. They also have their emails sometimes listed in their bios. So it's up to you, whatever method you want to. Let's talk about insurance. So I'm not going to be sharing my screen anymore. That was a little chaotic and I'm so sorry. But when it comes to using insurance, it's really important to know that not every single therapist accepts insurance. And insurance is such a very broad and vague term. Basically, us as therapists, we have to apply for an insurance panel specifically. So we often get asked, do you accept insurance? And you have to let us know which insurance specifically, because we could say yes, and the client may go ahead and submit an inquiry, but we may not be paneled with your specific insurance company. It's an application process for every single insurance panel. And so that makes it difficult. Sometimes they can select to be HMO with a certain panel, but not the EAP. Sometimes it's with both. So it's just, it varies in that sense. So always be specific when you're sending a message. And in regards to PPO and HMO, with HMO, you may know that it comes with lower costs. There's less flexibility and also less coverage. With an HMO, you're better able to regulate your premiums and overall your monthly pricing with it. It's going to be lower, but it will require you to see your a specific primary care provider. Okay, this is when it comes to your medical health, not your mental health yet. So you have to see someone within their network always. Okay, you're going to have your PCP. Sometimes, most of the time with HMO, your PCP will have to refer you to a specialist. You won't be able to find someone that you like, and go to them. You're going to have to get approval from your primary care provider first. Now, when it comes to therapy, you can only see a mental health therapist within their network. So even though you may like a provider from the directory that is self-pay or that is under different insurance panels, they will not be able to see you unless they are paneled with the HMO plan that you have, due to your job, due to your partner, your family, etc. So that's a really important distinction with this. And when it comes to using your HMO for mental health, I recommend that you call your insurance. There's a number on the back of the card, and you're going to tell them your policy number and all that information, and you ask them for a mental health specialist. They might ask you, is this for rehab, for substance use? Because that's a whole different department. They might ask if it's for psychiatry. In regards to mental health therapy sessions, you are looking for a mental health therapist or a psychologist. And so you want to make sure that you have that distinction. We are not providers that can prescribe medicine. Prescriptions are done by psychiatrists. So if you are looking for that or an evaluation, then that you're going to ask for that department. But if it's for therapy, for anxiety, for depression, for trauma, grief, etc., then you want to ask whoever you're speaking to if they can narrow by specialty or if they can narrow by cultural background. You might have to ask for Latino or Hispanic therapist. And if they don't have that, then I would highly suggest that you ask for Spanish-speaking therapists. From there's so many different people from various cultures that speak Spanish, but my strategy, when I was a single mom and looking for a therapist for myself, was to go through that list and I find the people that had a similar cultural background as me. And yes, that did mean I had to kind of go based off of their websites, but that was the process that worked for me, given the limited resources that the insurance provided. So with these insurance providers, you will also be probably having to wait a bit. I don't know if it would be a couple weeks. Sometimes it's a couple of months. That is part of the process. Unfortunately, the system is very broken. So I do recommend starting as soon as possible. If you have any questions, though, please always feel free to reach out. The best place for us is via email, support@latinxtherapy.com. And we are willing to answer your questions, in regards to navigating the insurance world in general. So the other option is going to be PPO. So there are a lot of therapists, especially in our directory and various directories, that accept PPO. And PPO insurance, there are higher monthly costs associated and sometimes even higher deductibles, but there is more flexibility with PPOs. You can see a medical specialist and even a therapist from anywhere that you're interested in without a referral. So yes, even if they're out of network, you can see them, but of course the therapist does have to agree. And so when it comes to the therapist world with PPOs, if they agree to see you out of network, that can mean one of two things. And you want to have this process clarified before you start therapy. You want to know if they are going to bill the insurance directly, or if you are going to have to pay out of pocket for the sessions, and they will give you a medical receipt called a super bill for you to submit to your insurance. Now with PPOs, when you go out of network, there's an in-network deductible. So you have to reach this amount for your copay, for your plan to get activated, and then there is an out-of-network deductible. We function out of the out-of-network deductible, and if that deductible is not met, then you are going to have to pay out of pocket, probably the full rate or whatever rate you and the therapist agree on, so that you could reach that out-of-network deductible, and then your insurance will kick back to you. They'll reimburse you. Or the therapist, depending on the agreement, they'll reimburse you the percentage that your insurance said that they would. Now, with this, it's also important to know that the out-of-network deductibles, depending on your insurance panel's plan, but typically they run on a calendar year. So January till December 31st, they reset to $0 January 1st. Now, if they're on fiscal, then you need to know that when it resets, it's probably from July till June 30th. But traditionally, typically, for most companies, it's January 1st when it resets back to $0. So a lot of our clients like to start this process in January so that they're able to reach that out-of-network deductible and get the most. So if you have to pay out of pocket starting in December, right, you're going to likely just be paying out of pocket. It's not going to go towards your deductible, since it's going, if you got other medical, if you had other medical appointments out of network, all those appointments basically go towards the out of network bucket. So I hope I didn't confuse you with this. The PPO process, there's something with each process, right? The HMO, basically not under any of these. Kaiser is their own hub. You must go with a Kaiser provider, but there are external mental health therapists, because with Kaiser, they're just so delayed when it comes to mental health that their appointments are traditionally 3 months away. So you see a provider, you have to wait for that first session, probably 3 months, and then your second appointment, when you're in-house, you're seeing a therapist that is at one of the Kaiser hospitals. You won't have your appointment until another 3 months away. And so that is a big problem when it comes to mental health and crises. So they, a while ago, agreed to have therapists who have their own private practices accept Kaiser as an external provider. And so in California, you have to know whether you have Northern California Kaiser or Southern California Kaiser. So in our directory, we are going to organize that better, because right now everyone's just hubbed. It's easy. It is helpful because you know who accepts it, but you're going to have to definitely ask for that distinction. Are you paneled in Northern Cal or Southern California? Okay. We're getting close to the end here. And so I'm going to talk about the consultation process a little bit more. So when you are reaching out to your therapist, it's up to you how much you want to say in the inquiry form, whether you're reaching out to them through our directory or through their website contact form. You're contacting them via phone call and leaving a voicemail. It's really up to you how much you want to provide, but I do recommend that you provide who the services are for, because we do get calls from loved ones, and so we need to know if it's for you or for them, and if they consent to going to therapy. If they are an adult or if they are a child, so how old the client is, and what is it that they'd like to focus on in therapy, or what's been going on that brings you or them to start therapy. Sometimes it's preventative and people may not have something going on. And so, you know, if that's the case, maybe the therapy is going to look like skill building and learning relaxation techniques. So just any information that you can give us to also make sure that we are a good fit, because we don't specialize in everything. That's another thing that's important to know. You want to be sure that you start off with someone that is a good fit for you, and a good fit is that you feel comfortable, you feel safe, like you can open up to them, and that they can help you, that they specialize in the therapy that you're interested in. So this may also require you to do a little bit of research into some of the theories and modalities that you see in their profiles. Like, for example, if you're not sure what EMDR means, then you might want to Google that to see, or even go on YouTube and see what an EMDR session looks like, so that you could place yourself, imagine yourself, can I do this process? Is this something that is for me? Or if they have psychodynamic therapy, that you learn a little bit more about that. Because there's some therapies that are more talk-based, and then others that are not, that are more somatic-based. We have had a lot of people share with us, I've been to therapy before and the therapist didn't ask me anything. They were just kind of waiting until I spoke. And so you need to understand what their style is, because if that's not your vibe, then you're not going to have a positive experience in therapy. And this may seem like common sense, but there's so many people that depend on therapists, right, to guide the session. And that's a very valid point. Your feelings are very valid. I think it's just part of that consultation process. Think of it as you interviewing the therapist to be sure that, they get the job, right? That they are the person for you and that you are for them as well. So these are some questions that I have listed on the homepage of latinxtherapy.com. And I am going to be expanding them because we do need some like systems oriented and oppression based, privilege based questions. But just in general, if you are just starting off, then it's really important to ask, when are you available for sessions, to be sure that you two match in availability. How long are our sessions? So if you're going to pay out of pocket, if it's insurance based, insurance restricts how many minutes the sessions can be, and the therapist, per their policies for self-pay as well. Traditionally, it's 50 minutes for self-pay. And so you just want to know, there are some times where you can have longer sessions. Maybe early on, you want to do longer sessions, like 75 minutes, 90-minute sessions, because you maybe want to do the assessment a little bit quicker, right? The first session is always going to be an assessment, whether you're starting with a new therapist for the first time, or the second time, third time, sixth time. The first session is likely always going to be some sort of assessment. And so it's not going to look the same in future appointments. Future appointments will likely be processing using the theory and the modalities that the therapist specializes in. But we do have to have a certain history and get to know you a little bit more in regards to how you cope before we get into deeper things. So you want to also ask, have you worked with someone that has lived experiences such as mine? So once you disclose what it is that you're seeking therapy for, so let's say anxiety, is this something that you've worked with before? Or if you want to disclose a little bit more, have you worked with anyone that has had anxiety where they can't breathe when they go to groceries, they don't socialize, or where the pandemic impacted them to the point where they don't talk to anybody, they lost all their friends, right? So you want to, if you feel comfortable sharing a little bit more of those details to understand if this therapist specializes in that, then that's also something that you can comfortable. Similarly with identities, have you worked with anyone that has you want to, I don't know, if you're finding somebody of the culture or outside of the culture, this is always a great question. What is your process like for the first session? What kind of therapy, treatment, or modality do you practice with your clients? Like I mentioned, the EMDR, cognitive behavioral therapy, psychodynamic, somatic work, narrative work. And don't be afraid to ask for the specifics of what each of these are, because again, like the way that we explain things to you, it goes a long way. So I'll speak as somebody that has always searched for therapists or psychologists in my adult life later on. I have found it very important to hear how they respond, because sometimes if they are snappy, or if, I don't know, if they just don't give as many details after I ask for more details, pues then that's not going to be the therapist for me. That hasn't been the right fit for me. So I just want to be sure that I also understand their terminology, the way that they're explaining the process, because otherwise, I'm comfortable in. So, 3 other questions here. How do you modify modalities for clients of color? Many of these theories and modalities were created for white people. And so a lot of us, especially from the directory, and I'll also throw out inclusivetherapist.com, that directory is great. Many of us therapists have worked on how to make these modalities make sense for our communities. And some of these things have caused harm, when we are first taught about them in our graduate school and go through that training process, because we're typically taught to process it by the book, to engage in it and apply it by the book. But later on, with working with clients from our community, we learn, how to kind of modify these theories and explain things in a different ways, or just switch things up. So I think that's always a valid question as well. So if you hear cognitive behavioral therapy or even EMDR therapy, any of these modalities, you can ask them, like, how do you apply these? Another one, how do you integrate social justice into your practice? Like, what kind of advocacy work? I've also noticed that, there have been some clients that don't like the amount of advocacy that some of us engage in online. We cannot separate politics from therapy and mental health. And so, and not to say that we're going to be bringing in our views in therapy or anything like that, but we definitely advocate for the things that are impacting our communities of color. And so if that's something that some clients are uncomfortable with, then again, we may not be a good fit. But I think social justice matters in this movement towards healing. And last question that I have, how can I tell if and when I'm making progress? So progress can be measured for some therapists, or maybe they give you self-report measures. And that's likely the case for those of you that need to use insurance or want to use insurance, because insurance will require things, because we get audited. And so that's something. And there may be another, not only would they use self-reporting measures or outcome measures, but maybe there's another way that the therapist assesses progress. And for us, that is going to be through your treatment goals, what it is that we decide on early on in therapy that you say you want to work on, and then that we collaborate with you to show you, okay, we can, I specialize in this, and this is how I can help you reach this goal. And so treatment goals and objectives are created within the first about 3 sessions. Sometimes it can take long depending on the assessment or the history that the client has been through, but typically it's done by the 3rd session. And so based off of those goals, you can tell that you're making progress. And in my experience, a lot of clients feel when they're making progress, because they may not be experiencing certain things like crying spells as much anymore, or there's a reduction in their nightmares, or they just feel different. And so there's to measure or to see if you're making progress. And so that's something that should always be every so often a conversation with your therapist in terms of how the therapy has made a difference for you. But with that, those are some of the consultation questions that I have on the homepage, latinxtherapy.com. We do have them in Spanish too. I am going to double check I post this. So if there's any other questions that you suggest asking that have been helpful for you as a client, or if you're a therapist and want to join this conversation, please drop it in the comments below after I activate them. And I want to thank you all who came on and watched this recording and who stayed on with me live. With that, thank you. I will go on live again. So it would be the same Wednesday at 10 o'clock in a month from 10 o'clock my time, PST, a month from today.